So I guess this should not come as a surprise. We knew that once one case of the Omicron virus, a coronavirus variant, was identified here in this country, we were going to see more, and that's exactly what's happening. More cases of the Omicron coronavirus variant has been popping up all over the U.S. At least 5 states have reported infections, but the real number could be much, much higher. New York reported at least 5 cases of the strain yesterday, and that's more than any other state so far. The known Omicron cases in the U.S. have been mild to moderate with no hospitalizations. So that's the good news. Nikki Battiste reports on what you can do to protect yourself.
The holidays are here, and with them, concerns about the Omicron variant, as millions of Americans shop, gather, and travel for the season. On Thursday, New York became the first state to detect multiple Omicron cases, all 5 in the greater New York area.
We have to assume that means there's community spread. We have to assume that means we're going to see a lot more cases.
2 other cases of the Omicron variant were also announced Thursday. Both patients reported mild symptoms. One case was a Colorado woman who had recently returned from southern Africa. She was vaccinated but had not received a booster. The second case was detected in a Minnesota man who received a booster in early November and whose only recent travel was an anime convention in New York City.
What COVID is doing is it's learning, it's adapting.
Dr. Tom Frieden is the former director of the Centers for Disease Control. He says it will take weeks at least before we know if Omicron causes more serious illness or if it can evade our protections.
For those of us who are fully vaccinated, who have had a booster, what should we do in the face of Omicron?
If you're older or immunosuppressed, or you live with someone who's older or immunosuppressed, you're going to want to be more careful. Indoor spaces, I think everyone should be masked. And the more of us who mask up, the safer all of us are.
That was Nikki Battiste reporting. Now, health officials are urging all of the 53,000 people who attended the anime convention in New York City to get tested immediately. And anyone in the U.S. looking for a shot, whether it's their first or third, can visit vaccines.gov, or text your zip code to 4388829 to find a free vaccine near you. So now I want to bring in Dr. Bob Lahita. He's a professor at the Hackensack Meridian School of Medicine and director of the Institute for Autoimmune and Rheumatic Diseases at St. Joseph Health. Dr. Lahita is also the author of the book Immunity Strong, which comes out next month. And he's also a reminder to me that it is Friday, because that is when you usually join us. So it's always good to see you, Dr. Lahita. So let's talk about the cases that have popped up in this country. We heard that the first people known to be infected in California and Minnesota, and as well as Hawaii, they've all experienced mild to moderate symptoms. The patients in California and Minnesota were already vaccinated, but the patient in Hawaii was not vaccinated. What does this tell us about the Omicron variant?
It tells us, Anne-Marie, that it may be more transmissible, although we don't even know that, but it certainly doesn't, it's not a barn burner right now. It's not causing very severe disease, and people are not winding up in intensive care units yet. We have our fingers crossed because it's always possible that things will change. I want to tell you that the person who was at the convention in New York City, that's the first intra-country transmission, somebody in the United States giving it to others in the United States. So I think it's a transmissible, possibly very transmissible variant. But right now, I'm very encouraged by the fact that it's not causing severe disease.
So the Omicron patient in Minnesota actually attended an anime convention in New York City right before testing positive. And, if we can show some video of just what that convention looked like. You can see, doctor, it's pretty crowded. People are standing pretty close together. I see a lot of masks, but I wouldn't be surprised if there are, unmasked people in that crowd, just, based on what I've seen just going out and about. Are you concerned that, this event may actually become sort of a super spreader for this new variant? And also, I guess, should people be rethinking going to events like this?
Well, I think people should be careful, particularly if you're immunosuppressed. As Tom Frieden said, if you're obese, have asthma, diabetes, chronic lung disease, heart disease, you should be wearing a mask, washing your hands, and keeping socially distant. You shouldn't be in crowds like that. And I know that you showed the Rockefeller Center Christmas tree, and there were thousands and thousands of people there. If you or I have ever gone to that, you know that you're shoulder to shoulder. That could be a super spreader event. Things like that, even though it's cold outside, which is a plus. The people that are in the crowd can transmit one to another, especially if they're cheering and yelling. It's also important to know that the holidays are upon us, and I'm worried about clusters inside homes, theaters, restaurants, where the disease could easily be transmitted, the variant.
And just quickly, you kind of already brought this up, though. The case in Hawaii of the first case in Hawaii of the Omicron variant, that individual had not traveled outside of Hawaii. I presume that's an indication that there's probably more cases in Hawaii that we're not aware of.
Absolutely. This virus is this variant is probably everywhere at this time, and we should be prepared for that.
The CDC released a brief saying that the Omicron variant has more changes in its spike protein than we've seen in other variants. It also says that the agency expects that people who have been vaccinated or previously infected with COVID-19 might not have as much protection from this new variant as they would have with Delta. Why might that be the case?
Well, these spike variants, these mutations, and I'm looking at a map here on the side here of 26 of these changes in the spike protein. The spike protein itself doesn't transform into something that's totally different, but these little changes, and there are 26 known mutations, will change the ability of an antibody, which is a protein that sticks to the virus. It'll prevent it from sticking to the spike protein the way it did with the Delta variant, for example. So that is the need for companies like Pfizer and BioNTech to produce a new vaccine or a new variation, much like we do with the flu vaccine every year. They're going to really tweak it so that we will, within 100 days, have a new vaccine for those who are very, very vulnerable to this new variant, this Omicron variant.
So I know we're learning about this new variant every day, and there's a difference when it comes to vaccination rates here as opposed to other places. But in South Africa is where it was first identified, scientists there. And a top South African scientist said that what she's seeing is more children under the age of 4 becoming hospitalized because of the Omicron variant. Last year, when we were dealing with the original strain of COVID-19, children were really hardly affected by this. What could be different about this variant?
Well, that's very, very interesting, Anne-Marie. You bring up a good point. I'm a little concerned about that paper that I've read about children under the age of 4 being more infected by the Omicron. I don't know why that could be the case. We see that with other diseases like respiratory syncytial virus, which is called RSV, or influenza, where children are primarily the targets. So COVID is now beginning to behave like one of those viruses, and perhaps, and I'm not going to make a blanket statement, but based on data from South Africa, I'm going to say that maybe children are a little bit more susceptible to this variant. And I'm hoping that it doesn't cause severe disease in kids.
So, as you know, we just got over our Thanksgiving holiday, and so people gathered with their family members. They may have gathered prior to Thanksgiving with friends for Friendsgiving or whatever they do. And we're already kind of seeing cases go up across the country. It's going to be a long holiday season, Doctor, if this is a trend that continues. How concerned are you about not just getting over the holiday season, but the rest of the winter?
I'm very concerned about that, Anne-Marie. And, we're waiting for the bump. Usually it takes 5 to 10 days after exposure to manifest symptoms. So far, I'm really impressed with the fact that our beds are not full, that the emergency room is not packed. And we're not seeing, and across the New York area, we are not seeing the kind of surge that we saw with Delta last year. But it's still too early to tell. And of course, Christmas is coming, and now we have the new variant. So we really have to be careful. But I'm not going to get panicked over this thing. And I don't think anybody everybody else should either. Just go about your ways and use common sense. Wear the mask when it's appropriate, wash your hands, and keep distant, particularly if you have somebody in your family that's not vaccinated.
Doctor, I think part of what makes a lot of this confusing is there are a lot of specialists, experts in the field that are kind of, that have, their take on this. And one of them is Pfizer and the other CEOs of these drug makers. So Pfizer has said that it's developing a vaccine that's meant to protect against the Omicron variant. I think that becomes a little confusing because people go, what, another vaccine? We might need another vaccine? I already got my booster shot. What is this all about? So the drug maker says that it could file for an emergency use authorization within about 100 days. I want to get your take on it. And I know you don't know what's going on, inside Pfizer, but do you think we would need a vaccine that's specifically for this variant?
Well, Anne-Marie, with molecular technology, it is so easy to produce a vaccine. I know a lot of people out there say, oh, this vaccine came very, very quickly. Well, it came quickly because we know molecular medicine now. We have different means of producing vaccines, far more efficient than 20 years ago. So it's quite easy to take the signature molecules to understand the variant and the mutations and to tweak a new vaccine, a new messenger RNA vaccine that will fit the profile of the Omicron variant. That's really incredible medicine. 30 years, even 10 years ago, that would not be possible. But now it's very exciting. And listening to the Pfizer or the BioNTech scientists I did this morning, I'm very impressed with the fact that they claim that they can have a new vaccine booster in a very minimal amount of time. Now, I don't think everybody needs that, but certainly if you're a vulnerable person, if you have, if you're tremendously obese, you're over 65 with multiple diseases, that's for you. And I'm encouraged by the fact that they're trying to be one step ahead of the game at all times.
All right. Dr. Bob Lahita, thank you so much. Have a great weekend.
You too, Anne-Marie.